Hey guys, welcome back to Listen to My Words. Today we're talking about pudendal neuralgia and interstitial cystitis, two conditions that can leave people feeling exhausted, isolated, and misunderstood. If you've ever questioned your own pain because no one else seemed to understand it, this episode is for you. We're diving into the realities of chronic pelvic pain, the emotional toll it takes, and how to advocate for yourself when the answers aren't always clear. If you're living with this, supporting someone who is, or simply wanting to learn more, I hope this conversation reminds you that your pain is real, your voice matters, and you're not alone. Let's get into it. Guys, thank you so much for coming back to Listen to My Words. Today I have Jenny Archer from Archer Physical Therapy with me. And she's a dear friend of mine, but she's also one of the best pelvic floor therapists in Nashville and has helped me tremendously. Oh my God, she looks so pretty.
Oh, thank you.
She looks great, but helped me tremendously with my interstitial cystitis pain, my pudendal neuralgia pain. And I've had a lot of people reach out to me online asking about this issue of mine, the surgeries, the pain, what it feels like. And so I have the best of the best in here to talk about this and to just do a short dive on all of the things. So Jenny, tell them a little bit about your business and get into it.
Yeah. So I own Archer Physical Therapy. We opened about 7 years ago. And I really started with trying to help. I've been a pelvic floor physical therapist for all the pain, but specifically pelvic pain. And then I kind of moved over into pregnancy and postpartum. But, you know, the pain patients find you. And so that was my first love. Something actually called vaginismus was one of my favorite things to treat. And that's where the pelvic floor actually like reflexively closes for a lot of different reasons, and it makes sex inserting tampons very painful. And so once I got into pregnancy, postpartum, and those things, coming back around to, you know, who gets pregnant are people that have a long history of pelvic pain. And so, or wants to get pregnant. And so I love helping those patients get to the pregnancy goals if that's something that they want to do, or once they are pregnant, be able to have a baby when they've had such a long history of pain with intercourse or pain with insertion. And so my love for pudendal neuralgia and interstitial cystitis, I also had what we now are thinking was an indwelling UTI for a long time, but it was over a year, so many years of pain in my bladder, frequency, urgency. So I deeply resonate with my interstitial cystitis and some pudendal neuralgia patients, but even like painful bladder, urgency, frequency, chronic UTIs, because I've been there and I know how crazy it makes you when you have this pain that you're wondering, is this ever going to go away? And so I now have a staff of 7 physical therapists that are also trained in all of these things as well. And so we offer in-home, and we have right now 4 office locations, hoping to grow next year into a couple of new locations. But as of right now, 4 locations in Middle Tennessee. And it's my passion to help people specifically with pelvic pain and any issues in their pelvis, leakage, pain, difficulty with orgasm or sex, all of those things. Nothing is TMI. I want to hear about it all. I want to work on it all. And then we get into a little bit of sometimes other things. So mental health. Mental health plays such a big role when you're dealing with chronic pain. So I do like to kind of know the state of my patient's mental well-being, because sometimes we need to refer out. So I love your podcast for that, because it really marries the two things.
Oh my gosh. I'm going to tell you right now, when I found Jenny, first off, I was going, this was years ago, 10 years ago?
I think it was.
10 years ago, I was in so much pain. I thought, this is it for me. I will never work. I will be on medical leave for the rest of my life, disability. I was married at the time. I was like, he's going to leave me. And I mean, literally you spiral. Like you can deal with it for like a couple of weeks and you're like, yeah, something's weird. And then they like give you antibiotics and you're thinking, where is the pain, where is it coming from? And when is it going to go away? And so I found you, and we were working because at the time we thought it was interstitial cystitis.
Yeah.
And I went to over 30 doctors,
Oh my gosh.
doctors. And I went everywhere. I went down to people down in Florida that were looking at long-term, like embedded UTIs. I was on antibiotics for 3 to 6 months trying to get rid of it, which was terrible, like disrupted my whole, microbiome, did all the things. And then after years, and we would work on it and my pain would get better because the muscles were all tight and crazy.
Yeah.
And she would find all these little things to work on. And I'd be like, oh, I have, 30% relief, 40% relief, which was significant because I could live my life, And then I finally had surgery with Dr. Lacchiani that was up in New Jersey. So I had surgery with him. And I was like, my journey is not over. Like at this point, I still need to have Jenny to work on scar tissues, all the things that I didn't even think about because I still sit all day. And she's like, okay, your tailbone and this. And so I really wanted her to go into some of the symptoms of interstitial cystitis and pudendal neuralgia and some of the things that you do. And so like if these people are not in Nashville and can't work with you, maybe to bring up to other therapists if they're going to their therapists to work on. But don't get too techie because people would be like, what?
Yeah, no.
I know you're so good. So anyway, get into that. And then, just helping people.
Yeah. Well, let's break those two things down because it's two completely different diagnoses.
See, that's why we have her.
And so, but there's some overlap of symptoms, of course, and that's exactly why with some of your symptoms, it was very reminiscent of interstitial cystitis. What's interesting to me is that from the get, I was like, she doesn't really sound like an IC patient. She sounds like some other stuff. And then we finally got that pudendal neuralgia, because interstitial cystitis, that's like those patients are going to the bathroom frequently all the time, even at night. There's never a reprieve from that. There's so much urgency that they're waking up constantly, even in the night. So we're talking about anywhere from 4 to, I've had some patients that wake up 15 to 20 times per night.
Holy
F. I know. And how can you heal if you're not sleeping? And that's a problem.
Yeah.
And so it starts with the daytime urgency and frequency. Urgency is that feeling like you need to go to the bathroom all the time. Frequency is you actually have to go, and it's a relieving factor. So with interstitial cystitis, it feels better to relieve yourself often. With pudendal neuralgia, you may have the urgency, but you may be able to put it off. Sometimes the issue with pudendal neuralgia is that putting it off can end up being painful because of the muscle guarding around your bladder. So that's why, again, with those two diagnoses, when that is your primary symptom of urgency and frequency, your pelvic floor physical therapist, your doctor really has to ask a lot of questions surrounding that symptom to know which one is it. And then there's a couple of other things. Is there tightness involved? Interstitial cystitis, for the most part, we're calling painful bladder syndrome now, because with true IC, we need to go into the bladder and see ulcers on the bladder wall. And what we're finding is that there's so many people who have those symptoms, and when you go in, they don't have the ulcers on the bladder wall, but yet they have all the symptoms of that. So it's this with IC or painful bladder syndrome, hormones are related. Your tension, how you breathe, how you sit, how you move in general. Do you have hip weakness? Those are all things that can contribute, and it can get started by maybe a UTI. It can get started by some nerve issues that turn into bladder symptoms, and it can also get started by scar tissue. So we have a lot of patients that start with an abdominal surgery. So think C-section, hysterectomy, abdominal laparoscopic surgery, anything that there's scar tissue around the pelvis, then that can create issues into the pelvic floor, or the pelvic floor tightens and creates almost like a vice grip around the bladder. And then that can cause a lot of your symptoms. So what we look at when we go into the pelvic floor, and we can go into the pelvic floor, whether you're a man or a woman. I think a lot of people still think that men don't have pelvic floors, but they do. We access that just rectally instead, although when we talk about pudendal neuralgia, I love to treat pudendal neuralgia rectally just because it helps get to the nerve a little bit easier. So if I can't get to it, if we're not making progress vaginally, then I like to keep that as a second that we talk about.
Yeah,
we
back
might
pocket.
have to, back pocket. I was going to say, I like to keep that as a back door, literally, pun intended. To treat.
Yeah, it is.
I know, but there's occasionally that patient that's like, absolutely not, over my dead body will we do this, but it is helpful. But as someone who lived with a lot of urgency and was woken up in the middle of the night multiple times, I mean, it can really spiral you. So I love, as a physical therapist, to pay attention to all the way up to how well do you relax your jaw? What is your posture like? Do you have tightness in your ribs? That actually does affect your bladder and your pelvic floor. And then we also want to do a vaginal assessment or a rectal assessment if you're a man and take a look at, is your pelvic floor too tight and is it gripped? And is that related to any feelings that you're having? Is it related to posture? Is it related to back or hip pain?
Yeah.
There's a lot of things to kind of suss out.
Yeah.
But there's treatment and there's hope, especially for painful bladder syndrome. Pudendal neuralgia, there is a nerve. So think about, we all know, or most people know about your sciatic nerve for your back. And everyone's been heard about like, oh, my sciatica. And they attribute that to like low back pain. So you kind of know. So pudendal nerve is the sciatica of the pelvic floor, if that helps you kind of think about it. So you've got this one nerve that innervates, it branches into 3, and then it goes up to the clitoris. There's a vaginal branch, and then there's a rectal branch. And so that helps your body have sensation, but also be able to move and relax. And we can get entrapments in a couple of different points. The main entrapment point is through 2 ligaments, and that's where you had to have your surgery, is to release the 2 ligaments. Y'all don't care what it's called, but for anyone who cares, it's sacrotuberous sacrospinous ligament, and they cross like this. And so because they cross, sometimes it can get too tight as that pudendal nerve is trying to pass under to be innervated by the pelvic floor. And so urgency, frequency, pain with insertion. Most often I get there's something in my rectum. There's usually a golf ball in the rectum sensation, or like something is just stuck there. And so we do a lot of work on that. And there's a lot of soft tissue work that I like to do specifically around the sits bone. And then into the back closer to, there's this other like knobby bone that you can feel in the pelvis called the ischial spine. And underneath that is Alcock's canal, which is where that nerve comes out. That's another area that we ended up having to do a lot of work for you on to just open, relax the muscles, make some space, bring in some blood flow. But we definitely want to be looking at more than just the pelvic floor, which again, for you, we've had to go into your hips, your back, even up to, there's been some sessions we've worked on your cervical spine, your thoracic spine, your ribs, your abdominals, all of those things. And so if your physical therapist is only working on your pelvic floor, then I would ask some more questions, or maybe find a physical therapist that's going to kind of take a broader approach, a broader look, to make sure that we're really thinking about all of the different aspects that can contribute to that pain. And so that is what makes pudendal neuralgia, to a certain extent, so much fun to treat, because you really have to be a detective and try to figure out.
Fun.
I know it's not fun for you guys, but definitely to come in with so much pain, and we really want to help. And our goal is to help you live a better life and feel empowered to, if you're having a pain or you're having a flare, what can you do to help mitigate some of that? And that's where we really love our job, is when our patients come in and say, I was able to get out of my house. I thought I would never leave my house, and now I can. Or I was able to go on a date, go on a bike ride, go on a hike. And so those are the things at night when I tuck myself in and I'm like, did I do a good job today? It's those comments that help me really anchor down to, like, I'm making a difference in the world. And especially the pain patients. And so that's what we hope as physical therapists y'all are getting at the end of the day.
Well, it's a lot. And you navigate so much. Like, you come in and some days you're like, this is what we've worked on last time. What are your symptoms? How are you feeling? And you go through this whole, questionnaire thing with me. And then you're like, let me check. And we think we're going one direction. And you're like, whoa, this is really tight over here. And I'm like, I didn't even realize that was like so bad. And you're like, let's just hold this. And it becomes a completely different session, which relieves my pain even more than the last time. So you're always just doing the little things. But what was really strange about my situation, which was why I went to so many doctors, urologists, I mean, everybody under gynecologists, everybody under the sun. My thing was I had so much exterior pain and the burning. And I would say the way that I described, because people will ask me this all the time, like, what was your pain? It felt like I had a cheese grater and they did this to the outside. And then they took salt and lemon and poured it on the out. And that burn was what I would feel. And that would stay for hours and then just dissipate just in a second. And I'm like, oh my God, thank God. Or if I was so afraid to use the bathroom because it hurt so bad. It felt like I was peeing glass shards. I was so afraid that I would hold it and I would, and holding it was so uncomfortable, but I knew that I would be in so much pain because after I used the bathroom, it would flare things up and it would last forever. It was never a relief. It was always just more pain. So it'd hold it forever, but then the muscles would all cramp around and then I'd have more pain. But I was like, hey, at least I'm out of that much pain for an hour or two afterwards. But it was always just like a catch-up game, like what. And then I finally, when I went in for surgery, you're thinking, this is it. Like, I don't care, whatever you have to do, like, give me all the drugs. Like, I don't care if I'm a zombie, but I can't live with this pain anymore. Yeah. Because it got to a point where even working together, you would get me, like, I sat in my car for 10 hours a day and they're like, you don't want to sit all day with pudendal neuralgia. And I was like, I have to change my career. So you would take my pain down and then the next day, I would be in the car for 10 hours and my pain would come right back. Like at the end of the day, I'd be sitting so long. So this is like really, I like to tell people that because they always are asking me what my pain was. But on the other hand, more men have been messaging me about pudendal neuralgia in the recent couple of, I would say, months. And so I'm glad that you said that men can have this worked on and that you can, start working on them in different ways than you obviously would work on women, but they could get relief as well. Because it's nice to have somebody say there is hope and it's fun. But like Jenny said, you're always looking outside the area that you think that there's the pain's coming from. There's so much more that's aligned. And that's why her group and her company is just absolutely amazing, because it's not just dedicated to one angle. It's like, let's look at a broader view so we can fix the whole body, I mean,
I've had to work on people's shoulders or feet, and that has been contributing to their pelvic floor pain.
Yeah.
And so there's all kinds of things and aspects that kind of blend into it to create, like, how did you get here? Typically, things don't just start in the pelvic floor. There's other things, external factors. And so you have to look at the whole body.
Yeah.
Sometimes you have to have conversations about their job. Do they enjoy their job? Are they in a relationship that is chaotic or maybe even unsafe? Because that can also lead to that constant fear and tightness.
Yeah.
Maybe that's where some of this pain is coming from.
Yep.
So you're really having to ask a lot of questions about, like, how did this get started? What's keeping it here? Because our bodies generally are pretty resilient, but there's typically something that's creating an environment that's keeping things there.
Locked in.
Yeah. And is it something that we need to do hands-on? Is this a physical therapy only, or do we need to branch out and get a team assembled? That's doctors maybe for medication, another surgeons to go in and release nerves or remove endometriosis. That's another thing I love to treat. So those things, like, we're not going to treat that with PT alone, but you need to know kind of who your team is, assemble your crew to help you be pain-free. And so having someone that can look at all of that, that's what you need.
Well, thank you so much. Today's been so informative, and hopefully this has helped you guys and you can relay this back to the people that you have working on you, or at least you have an idea that this isn't just an end-all be-all for you. Jenny, tell them once again about your company, how to find you, and we'll wrap it up that way.
Yeah. So you can find me at archerphysicaltherapy.com. We're also on the socials, Instagram, Facebook, if anyone uses that anymore. But Archer,
they do.
They do. Just Archer Physical Therapy, but you can book an appointment through there. If you're in the state of Tennessee, we also do telehealth. So we can talk to you through some self-help treatments. If you're living on the east side or the west side of Tennessee, I've had some people call me and set those appointments up, but we primarily do in person. We have 4 office locations throughout Middle Tennessee, and we also offer concierge physical therapy. So we'll come to you with the caveat that, unfortunately, if you're a man, we do have you come into our office, and that's just for safety reasons for my therapist.
Yeah.
Everyone needs to stay safe. And so if you want to make an appointment, see me at archerphysicaltherapy.com and then fill out the form, and we'll give you a call and set things up for you.
Thank you so much.
Thank you so much for having me.
You're welcome. I'm so excited. Thanks, guys. Thank you so much for joining me on today's episode of Listen to My Words. If you've enjoyed this conversation, be sure to subscribe, leave a review, and share it with someone who needs to hear it. For more content on relationships, self-worth, and personal growth, follow me on Instagram and TikTok and Facebook at Ashley Host, and visit ashleyhost.com to learn more about working with me. Until next time, trust yourself and pay attention to the patterns. I'll see you in the next episode.